Okay, hello. This video is going to be about the sensory tracts of the spinal cord. And there are three main tracts that will be discussed in this video, which are the dorsal column, medial lemniscus, the spinocerebellar, and the spinothalamic tracts. Okay, now we know that the white matter is basically where all the tracts and where all the axons ascend or descend in the spinal cord, while the gray matter is where the synapsing occurs. Hence, all the sensory tracts, as well as the motor tracts, since they're tracts, they will be found in the white matter. Okay. Now, where exactly each one is found, we will start first with the dorsal column medial lemniscus. From its name, it says it's a dorsal column, so it is found dorsally. And you can see here that this is posterior, hence the dorsal column medial lemniscus is in the dorsal part of the white matter. And in this side you have the anterior as well. Okay. Now, through the dorsal column medial lemniscus, you have two different subdivisions, the gracile and the cuneate. Now, you can remember which carries sensations from which part of the body by looking at the cuneate. You will see that it has a C in it, and this C can remind you of cervical. And if you remember that cervical, it is for the upper limb. Okay, the cervical dermatomes are found in the upper limb. So hence, the cuneate tract is for the upper limb, while the gracile tract is for the lower limb. Also remember that the gracile tract is medial, while the cuneate, so it's right over here, while the cuneate is lateral, so it's right over here. Okay? So the gracile tract is found throughout the spinal cord, while the cuneate is found only from the upper limb and above. Okay? Now the sensations that are carried by the dorsal column medial lemniscus involve two, okay? Or include two different sensations. The first one is the conscious proprioception, which is things like vibration, position as well. So if you feel any vibration, that's through the dorsal column, as well as position. For example, if you try to close your eyes and touch your nose, you'll be able to do that because of this tract. And the second sensation, it is the fine touch. So fine touch, for example, it's also called discriminative touch. So it's not, for example, if someone just puts their hand on your shoulder, that's crude touch. That's not fine touch. Fine touch is something more discriminatory. For example, if you try to touch the tip of a pencil. Okay. For the next tract, we have the spinocerebellar tracts. And through the spinocerebellar tracts, you have two different subdivisions. Again, for each one of the tracts, you have two different subdivisions. Remember that. For the spinocerebellar, you have the dorsal as well as the ventral. And this is because of their positioning. The dorsal is on this side, the ventral is on this side. Okay, or the ventral is is in front, dorsal is behind. And from its name, the spinocerebellar, it has cerebellum in it, or the word cerebellum can be found in it. And that's because, if you remember from foundation year, the cerebellum, it is responsible for balance. And balance basically means unconscious proprioception. Okay? So conscious proprioception is through the dorsal column. However, unconscious proprioception is through the spinocerebellar tract. Okay? Finally, we have the third tract, which is the anterolateral or spinothalamic tract. Now, from the anterolateral, you can find out that it has two subdivisions. Again, the first one is anterior or ventral, and the second one is posterior or is lateral. Sorry. Okay, so it has anterior and lateral subdivisions that are found in the white matter. Okay, now the difference here compared to the other tracts is that if you look at the other tracts, they carry the same kind of sensation. However, for the spinothalamic or anterolateral, you have different sensations that are carried. For the lateral, this is something that you have to memorize. For the lateral, it carries pain and temperature, while for the ventral or anterior, it carries crude touch. Now, what carries the fine touch or the discriminatory touch? It is the gracile and cuneate, okay, or the dorsal column medial lemniscus. However, for crude touch, you have the ventral spinothalamic tract, okay? And crude touch, for example, I said before, if a person just puts their hand on your back, that's a very general sensation. So it's crude touch, okay? And that's it. I hope that was helpful.